Diagnostic and Statistic Manual of Mental Disorders, 5th edition, DSM-5, is the reference book that mental health providers use to accurately diagnose psychiatric illnesses, and it defines a personality disorder as an enduring pattern of inner experience and behavior that deviates markedly from the norms and expectations of the individual's culture, is pervasive and inflexible, has an onset in adolescence or early adulthood, is stable over time, and leads to distress or impairment. So basically what that means is a personality disorder is a long-term pattern of feelings, thoughts, and behaviors that emerge during teen years or early adulthood, and they are different from what is the expected norm of that person's culture. So everyone has their own unique personality. It is what makes us who we are as individuals. Genetics, environmental factors, as well as innate predispositions and learned experiences all contribute to the development of our personalities, and they impact how we view the world, how we interact with people, and how we behave. However, when our feelings, thoughts, and behaviors become too extreme, when they're too rigid, inflexible, and unhealthy, then they can cause significant amount of distress and negatively impact our relationships, our work, and overall quality of life. When this maladaptive pattern of thoughts, feelings, and behaviors impact many aspects of our life in a negative way, then it is considered a personality disorder. There are 10 personality disorders and DSM-5 characterizes them into 3 different clusters based on their similar characteristics or symptoms. So cluster A is the odd, eccentric personalities. Those are paranoid, schizoid, and schizotypal. Cluster B are the dramatic or emotional personalities, and those include antisocial, borderline, histrionic, and narcissistic. Cluster C is the fearful or anxious personalities, and those include avoidant, dependent, and obsessive compulsive personality disorder. So borderline personality disorder, it falls under cluster B personality disorder. Patients with borderline personality disorder feel things very deeply and in an intensity that other people around them don't understand. This can give them an incredible ability to relate to other people and empathize with them, which is not a bad thing, but it can also cause what we would call an emotional paradox, where it can cause them to become over-involved, self-sacrifice, and make it challenging for them to maintain healthy boundaries. Also, BPD causes intense emotions that patients have a difficult time to regulate them. Regulating these emotions, impulsiveness, and reactions to difficult situations. So the best treatment option for BPD is psychotherapy. Psychotherapy is essentially a form of talk therapy. There's many different kinds. Dialectical behavioral therapy, mentalization-based therapy, and transference focused psychotherapy are all very effective for BPD patients. It's shown to help alleviate some of those symptoms, help them manage their extreme emotions, reduce some of that impulsiveness, and improve relationships. Omega-3 supplements have also shown to help with BPD symptoms. And lastly, there are pharmacological treatment options available to manage BPD symptoms as well. What questions or concerns do you have for me?